Hello, everyone. Thank you for joining this online talk titled Genetic Counseling for Hereditary Breast and Ovarian Cancer Syndrome. Am I at risk? My name is Jessamine Nazario, and I'm a genetic counselor. So to give you a little bit of a background about myself, I was born in Puerto Rico. I lived in Mexico City prior to coming to the United States. And as far as my education background goes, I received my bachelor's in biology from the University of Miami, and then I proceeded to do my master's in genetic counseling, which I got from the University of Colorado. I have been a genetic counselor for a total of 6 years, and I have worked in a variety of different settings, mainly related to cancer adult settings. So I worked for a radiology company in Denver, Colorado. I then worked as part of Yale New Haven Cancer Center in Connecticut. And more recently, I have joined Myriad Genetics Laboratories, where I'm part of the patient education team. So for today's talk, I'm going to be mainly talking about hereditary breast and ovarian cancer syndrome. And my hope is to cover the following objectives. So first, I would like for you to be able to identify factors that raise a suspicion for hereditary cancers, learn about the process of genetic counseling and testing for this condition, and also understand the implications of testing positive through a genetic test, what that means in terms of what that means for someone who has it in regards to their management, but also the importance of those genetic test results for family members and how it can impact them as well. So let's start with some background information. It is important to understand that cancer is common in the general population, and not all cancer is felt to run in families or be hereditary. In fact, the vast majority of cancers are not. They are instead cancers that happen due to a combination of different factors, such as environmental exposures, lifestyle factors, normal aging process, and some random chance. And they fall in the category that is known as sporadic, which is represented in this diagram by the light purple color. These are going to be the vast majority of cancers that you hear about happening, typically at older ages in individuals that have no apparent family histories. In contrast, generally speaking, about 5 to 10% of cancers are felt to fall in the category of being hereditary, which is represented by this pink color in this diagram. And this is going to be the main focus of our talk. So hereditary cancers happen when there is a known single gene change running in the family that is predisposing those family members to higher chances of developing cancer. Lastly, about 20% of the times we think cancers fall in this category that we call familial. And these are cases where we see multiple cancers in a family. There's not a known single gene change running in the family that is explaining that history. So these cases we think are most likely occurring due to a combination of shared environmental factors or even subtle genetic changes that are shared within a family. So we're going to focus on that smaller piece of that pie chart, cancers that are hereditary. So what does it mean when someone says cancer is hereditary? In order to best explain that, I want to start taking a look at how most cancers, just sporadic cancers, happen. And so we're going to use a little diagram here. In this diagram, this yellow circle represents a cell in our body. And so in sporadic cancers, someone is born with healthy cells. But as time goes by, these cells begin to accumulate genetic changes, which are marked in this diagram by that X. These genetic changes, again, occur due to a variety of factors, just as part of normal aging process, environmental factors, lifestyle factors. As time goes by, more of these genetic changes keep accumulating in that cell until it gets to a point where the cell loses control and it starts to divide uncontrollably, becoming cancer. Now, in hereditary cancers, someone is already born with one of these genetic changes in all of the cells of his or her body. And so that process of a cell potentially becoming cancer is that that person is one step ahead in that process of the cell potentially becoming cancer. And so that is why people that have a hereditary condition have a predisposition or higher chance of developing certain types of cancers in their lifetime. So this talk, we're going to mainly talk about breast and ovarian cancer. Again, I said not all is hereditary, so let's go over some general breast cancer facts. In the general population, about 1 in 8 women will develop breast cancer. So that means that all women have about a 12% lifetime risk of developing this cancer at some point in their lives. Most of the diagnoses that we see in the general population occur after age 50. And again, about 5 to 10% of breast cancers are felt to fall in that category of hereditary. Now looking at ovarian cancer is more rare than breast cancer, so about 1 in 78 women will get ovarian cancer. That is about a 1.3% lifetime risk that women have for developing this cancer. Again, most of the time, this cancer is also diagnosed after the age of 50, most commonly between ages 55 and 64. However, a greater portion of ovarian cancers are felt to be hereditary. Up to 25% of ovarian cancers are felt to fall under that category of hereditary. So you may be wondering, if not all cancer is hereditary, how do we even know which families with breast and ovarian cancer could have one of these underlying hereditary explanations? And so for this, healthcare providers, your doctor, or a genetic counselor, they may look for clues that may raise their suspicion by taking a deep look into your personal and family history of cancer. So some of these clues or red flags, so to speak, may include some of the following listed here. So for example, breast cancers that are diagnosed at young ages, typically under the age of 50 or 45, can raise some of those red flags. If we see multiple family members affected with the same type of cancer in the same side of the family, it can raise some red flags as well. Male breast cancer, that can raise red flags because male breast cancer occurs rarely in the general population. Also, the presence of ovarian cancer alone can raise some red flags. Again, that's because this cancer is more rare and a higher proportion of it is felt to fall under that hereditary piece of that pie chart. And also, the presence of other cancers in the family that may go along with these genetic conditions. So, for example, combinations of in addition to seeing breast and/or ovarian cancer, seeing pancreatic cancer in the family, prostate cancer, especially aggressive forms of it, that can also raise some of those red flags. So if you think you have some of those red flags in your family, then really the next best step would be to talk to your doctor so that you can review that in detail. And your doctor can then determine if further evaluation or genetic testing would be beneficial. In order to see if you have one of these genetic conditions, you do have to get genetic testing done. That's how we can determine if there is a mutation in the family. We're going to talk more about that. If enough suspicion is there and you and your provider agree that the next best step is for you to consider genetic testing, depending on your provider, they may feel comfortable evaluating that further and coordinating the testing for you. That may be something that is typically done in their practice. Other doctors may then refer you for genetic counseling so that you can get that further evaluation, and a genetic counselor can then coordinate that testing for you. Once genetic testing is done, of course, we would wait for results, and either your doctor or a genetic counselor would then be the person to review that in detail with you. So you might have never heard of genetic counseling or genetic counselors, or you might have heard of it mentioned but don't know a lot about it, and that's completely normal. It is still an emerging field. So I just want to talk a little bit about who are genetic counselors and the definition given by the National Society of Genetic Counselors is that genetic counselors help people understand and adapt to medical, psychological, and familial implications of genetic contributions to disease. More specifically, a genetic counselor is a healthcare professional who holds a master's degree and has expertise in medical genetics and counseling theory. If you get referred to a genetic counselor or you're interested in visiting with a genetic counselor, it is important to have a general idea as to what that visit entails. Most commonly, visit with a genetic counselor is either a 1 or 2-time visit. During the initial visit, the genetic counselor will first do an intake so that the genetic counselor can review your personal and family history in detail. Now, because we're using family history as a tool to determine risk of a hereditary condition, details are important. And so genetic counselors will typically draw out and ask about family members. Typically, they draw out a 3-generation family tree, and they'll ask questions about what are the types of cancers in the family, who in that family had that cancer, how is that person related to you, and also how old was that person when they got that cancer diagnosis. Because it's a 3-generation pedigree minimum, typically they ask about not only parents and siblings, but also aunts, uncles, cousins. But even if someone knows more distant relatives with cancer, like great-grandparents, great-aunts, uncles, that's all important. So however much information you know, it's always best to provide all that you are aware of. But knowing the types of cancers and ages of diagnosis are important in evaluation. Okay, so based on that information that is obtained, then the genetic counselor will assess the likelihood of a genetic cancer condition in the family and what specific genetic conditions, genetic syndromes we should be thinking about. They will then review some information about cancer genetics in general, the testing options, so that you can make an informed decision about whether or not you would like to proceed with testing. If testing will be done, the genetic counselor will then coordinate the paperwork, provide consent, coordinate sample collection, and send that to a genetics laboratory for testing. The time that results take to get back varies depending on the type of testing, the laboratory, and all of that. Typically takes between 2 to 4 weeks for a lot of these cancer genetic testings to obtain results. And once results are ready, either the genetic counselor or your doctor will interpret the results in the context of your personal and family history and discuss them in detail with you. They can also help, genetic counselors can also help find resources, so good credible sources of information to supplement your results. Also, they may help identify support groups in the area if that would be of benefit to the patient and it's something that they're interested in. So we talked a little bit about the process of what to do if you think you have some of those red flags in your family, what to expect if you get a referral to a genetic counselor. But now let's talk about the main genetic condition that is associated with hereditary forms of breast and ovarian cancers. So a lot of you might have heard about this condition. It's called Hereditary Breast and Ovarian Cancer Syndrome, HBOC for short. If you hear me for the rest of this talk, I might refer it as HBOC. And so again, this is the most common cause of inherited breast and ovarian cancers. Both men and women can have this condition. It is often mistaken that this condition only affects women. So it's important to know that it's important for men and women. And individuals who have HBOC can also have elevated risks for other cancers aside from breast and ovarian. So we're going to get into that next. So these are some of the main cancers that can be seen in families that have HBOC. The main cancers seen in women that have this diagnosis is, of course, breast and ovarian cancer, which is kind of the main bulk of our talk. But women can also be at a elevated risk for other cancers like pancreatic and melanoma skin cancer. Men who have HBOC, they have mainly an elevated risk for prostate cancer, oftentimes more aggressive forms of it, or even metastatic prostate cancer, which means that the cancer has spread beyond the prostate gland. But again, men could also have elevated risk for pancreatic cancer and melanoma skin cancer as well. Now, just because these different types of cancers have been linked with this condition, that does not mean that a person who has HBOC will develop all these cancers. In fact, having this diagnosis does not guarantee that you will develop cancer with 100% certainty, but rather that the lifetime risks to develop these cancers are higher than what we see in the general population. So right here, we have a graph that gives you a general idea of the lifetime risks of some of those cancers to someone who has HBOC, is represented by the pink bars, compared to the lifetime risk of the same cancer seen in the general population, which is represented by these more purple bars in this chart. You can see that the highest cancer risks are breast and ovarian cancer in women. So they are significantly higher compared to the chance of getting this cancer in the general population. But again, it's important to understand that it's not a 100% guarantee. And so that's why it's important, because there may be ways, if someone has this condition, to manage these risks, to try to reduce those risks. Men, again, looking at this chart, they do have a higher risk compared to the general population for prostate cancer and male breast cancer. And then, as I said, pancreatic cancer can be elevated. The absolute risk of getting pancreatic cancer in someone who has HBOC is still fairly low. So the majority of people that have HBOC will not develop pancreatic cancer, but it is, elevated compared to that risk seen in the general population. So what causes this condition, HBOC? This is the condition that is caused when someone has a gene change, or what we call a mutation, in either the BRCA1 or BRCA2 genes. A lot of you might have heard about these genes, or a lot of people know these genes as the BRCA genes. So these are the two genes that are responsible for this specific condition. And so let's talk a little bit about the inheritance of these genes. So in this diagram, I am representing the gene by the purple rectangle that is now popping up in your slide. So we all typically have 2 copies of these genes in our cells in our bodies, and this is because we inherit 1 copy from dad and 1 copy from mom. When both of the copies are working normally, represented by this solid color, then these genes are working normally and protecting us from developing certain cancers. And so this person does not have HBOC. However, if you now look at the figures on the right-hand side of your screen, again, this person inherits 1 copy from mom and 1 copy from dad, but in this case, in this person, the copy that came from dad has a mistake or a gene change or a mutation. And so that causes that person to have, don't have the same level of protection against cancer. And so this person is then said to have HBOC. Now, it is important to understand that the mutation can either come from dad or from mom. It doesn't matter. The bottom line is that if one of the 2 copies of your genes have a mutation, that's enough for that person to have elevated risks associated with that condition. So what happens if you're diagnosed with HBOC? Some people may wonder, what can be done if there's a mutation? And so there is actually a lot of options that you and your doctors can consider to manage and try to reduce those risks. There are medical society guidelines that have been created to help guide providers know what type of screenings and risk-reducing options to talk to their patients about. And so I will be reviewing some of those specifics in the next slide, but I first want to give a general overview as to what typically takes place. So generally speaking, individuals that have HBOC will start certain cancer screenings at younger ages, may do them more frequently, and consider risk-reducing strategies. The management plan may depend on different factors. A specific gene change found in your family may play a role in determining the specific management for you, your family history, and personal preferences. So it's important to have a conversation with your provider who has an expertise, or with a provider who has an expertise in HBOC to get the best plan for you. So again, I said this slide was going to be pretty busy. I'm just going to go through some of the main considerations, but these are some of the management options provided by these society guidelines. So again, for breast cancer, mainly the idea is that women start breast cancer screenings earlier than what is typically seen in the general population, so in their mid-20s. Women that have HBOC, a lot of the times they get breast MRIs done in addition to their yearly mammograms. And they may consider removal of both breasts, so double mastectomy, prophylactically, meaning before any cancer happens, just as a way to reduce those risks. Men who have HBOC, they may do some clinical breast exams just because of their risk being a little bit higher. In order to address ovarian cancer, there are several options. There are some screening options that can be considered, like a transvaginal ultrasound or checking some blood markers. It is important to have a conversation with doctors about the limitations, some of the benefits and limitations, because not all screenings are going to be equally effective. So it's important to really understand the benefits and limitations of those types of screenings. A lot of women that have HBOC will consider removal of their fallopian tubes and the ovaries once they're done having children to reduce those risks. Now, pancreatic cancer, in order to address that risk, screening options may be considered under an expertise group or in clinical trials, but at this point in time, it's particularly more important to consider these type of screening if there is a positive family history of that cancer, because again, the absolute chance of getting pancreatic cancer is still fairly low, and so a lot of it depends on the family history and again, personal preference and what your doctors may consider for you based on your history as well. And for men with HBOC, because of the risk for prostate cancer being elevated, they can consider prostate cancer screenings beginning at age 40, and that typically entails looking at a specific blood marker or through a digital rectal exam. So if you have HBOC, not only is that important for you, as we just talked about, there might be some changes in your management to monitor you more closely or even try to reduce those risks, but it's important for your family members. And so we always encourage that you share your results with your family. If you're found to have a gene mutation, your siblings that are from same mom and dad as you and your children would each have a 1 in 2 chance or a 50% chance of having that same mutation. So it's important that they talk to their doctors about considering their testing, because they may also benefit from more screenings or preventative options. One last thing I want to note about genetic testing is there are different testing options. This talk mainly focused on the common cancer genetic condition associated with BRCA genes, but there are other genes that have been more recently linked with hereditary forms of these cancers. So it is important to discuss testing options in detail with your provider or a genetic counselor. For some of you, some people do a targeted type of testing depending on what is seen in their family. But a lot of the times, especially nowadays, a lot of providers and counselors are talking about considering a more extensive test, which we call panels, where they can, the laboratories can look at multiple genes at the same time in one test. So always make sure to review that information with your providers. So to summarize, here are the key takeaways from this talk that I hope you can remember and use when discussing with your family and your healthcare providers. Not all cancers are hereditary. Knowing the types of cancers, ages of diagnosis, and number of people affected in your family helps to uncover some of those red flags. There are different genetic testing options, so it's always important to discuss with your doctor and genetic counselor those options and what would be best for your case. And again, testing positive for gene mutation may indicate cancer risk, so there are ways to manage those risks. Talk to your doctor, get referred to specialists in order to determine the management strategies that are best for you. And always, always share your results with your family members if you can. It is important. It may also impact their management. Thank you all for listening to my talk. If you want more information about genetic counseling or finding a genetic counselor in your area, you can always visit this website, www.nsgc.org. Thank you.